You are on adults class. This is Mr. Smooth, and you are in Mr. Smooth's classroom. And like I said, today we will be talking about the benefits and risk of taking birth control pills. I will be probably showing you a couple of videos of how conception takes place, and then talk about the whole system, what emergency contraceptive pills are, what they do, what they are made of. Are they okay to use them? When are they supposed to be used? Who is supposed to use it? The number of times you're supposed to use it, and then if you are using them, do they have any effects on your future fertility? It is so common to find young people who engage in sex, especially when they are not married, trying to prevent unwanted or unplanned pregnancies. So they use the emergency contraceptive pills and other oral contraceptive pills as a way of securing themselves or protecting themselves from getting pregnant. But how secured are these tablets or these methods that these people use? Are they something that we should encourage? Is this something that you as a lady should do? Is this something that you as a man should encourage your girl or your wife or the woman you are with to use? But before I start even the lessons, I have a video that is going to show you from the very start how the sperm leaves the man, gets into the woman's womb, and how it meets the egg and how fertilization takes place. I'm going to show you the whole process, and after that I'm going to talk about a little stuff about contraceptive pills and how they are made and what is made up of, and then from there we'll look at how emergency contraceptive pills block the sperm from getting in, and then we can also look at whether we should encourage it, or we ourselves or ladies who are using it should not do it. So stick and stay, watch this video.
Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, They attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
All went through this process to survive, to become humans, to live like we have done. And like you saw in the video, as many as 300 million sperms were released, and only one was able to fertilize the egg. All the others died along the line, and even crossing the vagina's acidity itself killed several millions of them. And you also saw that just a few hundreds were able to reach even closer to the egg. So it's a whole journey the sperm goes through to fertilize. Now, what most people have decided to do is they have sex when they don't want babies. They release sperm. And what do you want? If you don't want babies and you're releasing sperm, what is it? Definitely the sperm is for babies. So if you don't want babies, you don't release sperm. You can have sex without releasing sperm, but once you release sperm, it means you're looking for babies. So the men who think that every sexual encounter should end with an ejaculation, this is something that you should note, that 300 million sperm you're throwing away virtually is wasted if it is not generating a baby. Beautiful. Now let's look at what emergency contraceptive pills are. So we are going to have a basic lesson. We are going to look at what emergency contraceptive pills are. 1. Emergency contraceptive pills actually are a method that is used to prevent pregnancy after an unprotected sexual encounter. Now, people will call it ECPs or postcoital contraception. Some are oral medications. Some are consumed by women, and then when they have unprotected sex, they actually consume these pills. Now, emergency, as in the word emergency here, we are referring to women that have been raped and they are afraid of getting pregnant. so they can use the emergency contraceptive pills. There are times when you try protecting yourself and then the condom either spills or the condom breaks. You can use the emergency contraceptive pills, or probably you are on normal everyday contraceptive pills and then you have missed a tablet or two and you are not certain of your safety or security as to becoming pregnant, so you can use the emergency contraceptive pills. And then also, it should be understood that the pills should be taken immediately after intercourse or within a window of 5 days of having an unprotected sex. You should also note that they work before ovulation takes place. So if you ovulate and you take the emergency contraceptive pills, you still get pregnant. I'm saying that they work before ovulation takes place. So you should take the emergency contraceptive pills before ovulation takes place. Now, no form of contraception or contraceptive methods is 100%. We should know that. No form is foolproof. But emergency contraceptive pills are basically to reduce the chances of conception, especially when you have unprotected sex and you're not looking for babies. You should also understand that emergency contraceptive pills will not terminate your pregnancy. So if you're already pregnant, the emergency contraceptive pills will definitely not terminate your pregnancy. And then also, they are not recommended for routine usage. You're not supposed to use them all the time. So for most ladies or for most young girls who take them every time they have a sexual encounter, this is something that you should watch and then see the effects it can have on you, and then you can learn and then find better ways of dealing with yourselves when you have that desire for sex and then you think you're not safe or you're not married and not ready for children. And then also you should note that emergency contraceptive pills will not protect you from sexually transmitted infections and sexually transmitted diseases. You should know that. Now, there are many types of emergency contraceptive pills available. Some you can pick off the shelf, some you could just walk into the drugstore and pick. There are so many of them, but mainly the ones that are common in our part of the world is made from a chemical called progestin. Progestin is actually a hormone that acts like or has its effects like progesterone. Progesterone is a female hormone, and then progesterone is produced mainly by the ovaries following ovulation. Also, each month when you ovulate, progesterone is released. It is actually a crucial part of every woman's menstrual cycle and the maintenance of the pregnancy. It helps in the woman's menstrual cycle, and then even its main job is to make the uterus ready for the pregnancy. So progesterone does a lot of things. After ovulation, it helps thicken the uterus lining so that it prepares the uterus lining for the fertilized egg to come and be able to implant itself. Now also, if there are no fertilized egg in the fallopian tubes, progesterone levels drop, and once they drop, menstruation would begin. So progesterone is very, very important for women, for females. Now, if the fertilized egg is implanted in the uterus or the uterine wall, progesterone will help maintain the uterus lining or the uterine lining throughout pregnancy. It thickens the lining throughout pregnancy, and that is what the emergency contraceptive pills actually takes off, makes it lighter, and we'll see the effects that it has on women as they continue to use it. So when your progesterone levels are relatively low before ovulation, they steadily increase. They are steadily increased when you are ovulating, or when you ovulate, the progesterone levels steadily increase, and then the levels would sort of change as time goes on within your menstrual cycle. It changes, it rises and reduces as and when you are getting close to your menstruation, as and when you are ovulating. The range of progesterone you have in your body also varies around that time. Now, if your progesterone levels do not increase or decrease monthly, as I'm talking about, if they do not increase and decrease based on whether you're getting close to ovulation or after ovulation you're menstruating, if these things do not happen, then you have a problem with ovulation, and then you're going to have problem with your menstruation, or both. So if your progesterone levels are low, you're going to have problem with ovulation, you're going to have problems with your menstruation, or you're going to have both, and this may lead to infertility. So progesterone levels in females is key. When a woman, or when any woman experiences multiple pregnancies, when you are having quadruplets and all those things, it is just a problem with abnormally high progesterone levels. Normally, when your progesterone levels are normal, the body releases just one egg. But if your progesterone levels are extremely too high, you have 2 eggs or more being released, and you have unidentical twins, or you can have a twin while the egg is rolling from the fallopian tube to implant itself inside the womb. So it is like not what people say that is a blessing to have twins and all those things. It's simply because you have high progesterone levels, and people should understand that. Now, you can do a blood test to actually test your level of progesterone as a woman. There are many, when you go to the labs, there are many tests that you can do to check your progesterone level, and the results, it actually determines how fertile or infertile you may be, and if there's anything, it can be diagnosed. And if your progesterone levels are bad, you can have stuff like ectopic pregnancies, where the pregnancy develops out of the uterus or out of the womb. You can have problems with failing pregnancies when you have miscarriages, and then you can also have problems with abnormal bleeding. So you can see that you are not having your menses, or it is not time to have your menses, but you are bleeding profusely, and your bleeding is not stopping. It's simply because you have a problem with your progesterone levels, and that is what you need to look at. Now, progesterone levels, when they are low, like I said, may be difficult for a woman to keep a pregnancy when your progesterone levels are low. Now, they are also important in the development of the breast when you are in your teens, and then when you're pregnant, it is also responsible for developing of the breast milk, and then also it works together, or to works to complement the effects or efforts of the estrogen, which is the main female hormone, the main female hormone. So small amounts are needed. Even in men, small amount of progesterone is needed in producing the male sperm. So you should understand that low progesterone levels will cause abnormal bleeding in women, especially when they are not pregnant. And then also, it will make women have irregular menstrual cycles, or women will not have menses at all. And this is indicative of poor functioning ovaries, and a major cause and symptoms experienced by women who are aged, women who are entering their menopausal age. I'm saying that when your progesterone levels are low, you are going to be experiencing problems like abnormal bleeding, when especially you are not are pregnant, you'll be bleeding when you're not pregnant, and then also you have irregular menstruations, and then for some people they will not menstruate at all. And I'm saying that if you're experiencing stuff like that, you are not pregnant, and then you are bleeding profusely, you are bleeding when it's not even time for you to have your menses, or your menstrual cycle is actually not coming when you're supposed to menstruate, you're not menstruating at all. I'm saying that this is indicative of the fact that your ovaries are not functioning well, and it also means that your progesterone levels are a little too low, and you need to do something about it. You need to seek help, especially if you are not a woman who is entering into her menopausal age. So women, or if a woman does not ovulate, her ovaries do not produce progesterone. If you do not ovulate, your ovaries will not produce progesterone. And if you're not producing progesterone, it means your progesterone levels are low, and you can bleed even when it is not time for you to menstruate. So you should take note of that. You can see women having blood flowing from under them weeks and weeks and weeks when it's not even time for them to menstruate. It's simply because their ovaries are not functioning, and then their bodies are not producing progesterone, and then that is why they are bleeding like that, and they should quickly seek medical care. Now, in pregnancy, you need progesterone, like I said, to keep the child inside the womb. During pregnancies, when you start experiencing spotting, like you are pregnant and then you experience spotting, you are pregnant and you realize that you're having an ectopic pregnancy, you see that your baby is dead or you have a miscarriage, and then you should understand that your progesterone levels are low. And once your progesterone levels are low, these are some of the things you're going to experience. And then also, once your progesterone levels are low, estrogen, which is actually the main female hormone, becomes dominant when your progesterone levels are low, and this will lead to the woman becoming overweight, because the estrogen would boost up and become the main female hormone. Instead of having that balance with the progesterone, the estrogen takes over, and then the woman becomes very obese or becomes big, and immediately your progesterone levels go down, your libido would also go down, your desire for sex will also go down, your feeling for arousal, and then when you have sex you don't feel anything. I've had thousands of women call me and say, when I have sex I don't feel anything, and it is simply because your progesterone levels are low and your libido goes low. And then also, for such women, you see them, they always have mood swings, they are always angry. With the slightest thing they become angry, they become extremely obsessive, extremely jealous. It's simply because their progesterone levels are low, and then they become depressed easily, and then their cycle or menstrual cycle, like I said, becomes irregular. They experience very heavy bleeding, and then their breasts become very tender, and then they have fibroids and gallbladder problems. So these are issues that young ladies who are using emergency contraceptive pills that would drop your progesterone levels should take critical look at, because as you continue to use the emergency contraceptive pills that will drop or put in artificial progesterone in your body, you should know that these things are likely to happen to you as you continue to use them over a period. So progesterone is very important in maintaining the endometrium throughout your pregnancy, and then also for the future release of eggs from the ovaries for pregnancy to take place, you need progesterone. And if you are not releasing the egg, if you're not having the egg, it means your ovaries are not functioning well. So it is important that you prevent fertilization of the egg before the egg is laid, because once the egg is laid, then you're going to have sort of problem. So if your what do you call it, your progesterone levels are also low, these are some of the things you can also experience. You can also experience, or you see that the contractions of the fallopian tube that sucks the egg to transport the egg along the fallopian tube so that it will be planted inside the uterus, as you saw in the video I showed earlier, becomes bad because then it can't suck it. That is where you see the egg staying inside the fallopian tube, and then you start having what do you call it, ectopic pregnancies. And then it's important that you also look at this. Now let's look at this. Progestin is one of the ingredients that is used in producing these emergency contraceptive pills, and it is synthetic steroid hormone. It behaves like progesterone, and it has the properties that progesterone has, but progestin is actually available everywhere. You can find them in the form of capsules, some are in gels, some are as implants, and some are even as injections. So progestin products, or products with progestin that are used for emergency contraceptive pills, are available, and there are so many products out there that have this product in it. So it's important that you look at this. Emergency contraceptive pills may prevent pregnancy by temporarily blocking the egg from being released. So here what I'm saying is, you are taking a medication that is going to stop the brain, the pituitary gland, the pineal gland, the core of your endocrine system from functioning the way it should function. The endocrine system and the whole body is designed to release an egg at a certain period so that fertilization will take place, or you can have your regular menses. But you are taking an artificial progesterone, and that progesterone is suppressing or delaying the laying of the egg. It means you are changing the body's normal function, the body's normal way of producing the egg. You are delaying it, you are stopping it from taking place. And you are doing so because you have had sex and you think you will get pregnant, and you don't want the pregnancy, so you want to just delay it. Okay, you can do it, but I'm saying that this immediately you have that unprotected sex between 72 hours of that unprotected sex. If you have not ovulated already, then you can take any of these medications with this progestin in it. But here also, it's just about 90% close to success, because some people still take it and still get pregnant anyway. Now, what this actually does is, it changes the lining of the womb and prevents pregnancy from developing. I'm saying that it changes the lining of the womb and prevents pregnancy from taking place. And then also, some would also thicken the mucus around the cervix to prevent the sperm from entering. It will thicken the mucus around the cervix and prevent the sperm from entering. That is what some of the emergency contraceptive pills do. Okay, so here also there are other types of emergency contraceptive pills that are non-hormonal pills, but they contain selected progesterone receptors, and they actually copy the way the body produces its natural progesterone, and most times the body is able to tolerate that kind of emulation or copying of the progesterone for about 5 days. It keeps you protected when you have unprotected sex. But it is believed that it is more effective when you use progestin only, because then you are saving yourself. So that is some of the benefits of using, and it should be done before the ovulation takes place. Another type of the emergency contraceptive pills that people should also look at is a combination of the contraceptive pill with hormone, estrogen, and then progestin. There's a type that is a mix too. That is also okay, but it has the side effect. The side effect is, after you use it, you feel nausea and you feel like vomiting. So it's something that you should look at. But I'm going to show you some other video here.
Here's what has to happen for pregnancy to occur after sexual intercourse. Sperm must swim up the vagina, through the cervical opening, upward and into one of the two fallopian tubes. If an egg, released during that month's ovulation, is in the tube, one sperm has a chance to fertilize it. Contraceptives are designed to prevent this process, and they work in three basic ways. They block the sperm, disable sperm before they reach the uterus, or suppress ovulation. Block is the simplest. Male and female condoms prevent sperm from coming into contact with the vaginal space. That barrier is also why they, unlike other contraceptive methods, are able to prevent transmission of certain sexually transmitted diseases. Meanwhile, the diaphragm, cervical cap, and sponge work by being placed over the cervix, barricading the entrance to the uterus. These contraceptives are sometimes called barrier methods and can be used with spermicides, an example of the second category, disable. A spermicide is a chemical that immobilizes and destroys sperm. Today's spermicides come as foam, cream, jelly, suppositories, and even a thin piece of translucent film that dissolves in the vagina. These products can be inserted directly into the vagina before intercourse, or can be combined with block methods, like a diaphragm or condom, for added protection. The third category for preventing pregnancy works by suppressing the action of an egg maturing in the ovary. If there isn't an egg available in the fallopian tube, there's nothing for sperm to fertilize. Hormonal contraceptives, including the pill, the patch, the depot shot, and the vaginal ring, all release synthetic versions of various combinations of progesterone and estrogen. This hormone cocktail suppresses ovulation, keeping the immature egg safely sequestered in the ovary. Synthetic progesterone also has a block trick up its sleeve. It makes cervical mucus too thick and sticky for sperm to swim through easily. There are other contraceptives that use multiple approaches at the same time. For example, many IUDs, or intrauterine devices, contain synthetic hormones which suppress ovulation. Some also contain copper, which disables sperm while also making egg implantation in the uterus difficult. Block, disable, or suppress. Is one strategy better than the other? There are differences, but a lot of it has to do with how convenient and easy it is to use each contraceptive correctly. For example, male condoms would be about 98% effective if everyone used them perfectly. That 98% means if 100 couples correctly used condoms for a year, 2 women would get pregnant. But not everyone uses them correctly, so they're only 82% effective in practice. Other methods, like the patch and pill, are 99% effective when they're used perfectly, but in practice, that's 91%. Spermicide is only 85% effective, even with perfect usage, and just 71% effective with typical usage. Another important consideration in the choice of contraceptives are side effects, which almost exclusively affect women rather than men. Hormonal methods in particular can cause symptoms like headaches, nausea, and high blood pressure, but they vary from woman to woman. That's why these methods require a prescription from a doctor. The choice of contraceptive method is a personal one, and what works best for you now may change later. Scientists also continue to research new methods, such as a male pill that would prevent sperm production. In the meantime, there are quite a few options to block sperm, disable them, or suppress eggs and keep them out of reach.
You're back, and then you saw what the contraceptive pills do to prevent yourself from getting pregnant. You saw all the 3 methods that I showed you. So from the ones that you think are safer, look at it. So that is the benefit. Now look at this other video that talks about the side effects of using contraceptive pills.
I'm a leading and the long-term consequences and side effects associated with hormonal contraceptives. And in this video, I want to chat with you about how these hormones can actually wreck your fertility. So here's the deal. There's a lot of ways that hormonal birth control can actually interfere with fertility. And if you're like me, I did the pill for 10 years, and every year, and more frequently than that sometimes, I'd be having a conversation with my doctor about my fertility. and every time I would be assured that there was no impact whatsoever. You've probably heard this story too. Now, here's the reality. If you're taking a drug or you're using a drug that is strong enough to stop how your brain talks to your ovaries and shut down your fertility, we're talking about shutting down your endocrine system. If it's strong enough to do that, it's certainly strong enough to have some major long-term consequences and impacts to your fertility. Now, whether or not you want to have a baby, you want to be fertile. Why? Because if you're ovulating, that's going to get your progesterone up, your periods get easier, you feel way more chilled out and calm, and you're loving your life. It's some good stuff. So here's one mechanism by which the birth control pill and some of these other hormones can actually mess with your fertility. See, there have been studies to show that women who are long-term users of the pill, so we're talking 10 years or more, have thinner lining of their endometrium. Let me back up and explain what that is. The endometrium is the tissue that lines your uterus. And I want you to think about it like this, okay? So the endometrium should be a certain thickness for baby to basically set up shop in your uterus. Call it home. Think about the uterine lining like being like a nice soft bed with a big thick down comforter versus sleeping on the floor. Which one would you choose? Obviously, baby and you would want to choose that nice, comfy, thick comforter instead of the hard floor. Now, it's not because the floor is hard, okay? That's just an analogy to give you an example of, okay, how the thickness of the endometrium can really affect the implantation of the baby. Now, this is a really sad situation when this is taking place for a woman because what the research has shown is that there can be some resistance in actually having women build up that endometrium again. So how does this happen? Well, one theory is that the birth control pill downregulates the receptors for estrogen and progesterone in the endometrial tissue. You need those hormones to stimulate the tissue so that it thickens to the right thickness for accompanying a baby. And whether or not you want to have a baby, your body will still go through this every month. When there is no baby, this is what you shed. The endometrium sheds out of the uterus, and that's what we call your period. So with women who use the pill for 10 years or more, there is a possibility they're going to have compromised fertility because the baby will not be able to implant. That means egg can meet sperm, you can become pregnant, but you won't be able to remain pregnant because your uterus won't be able to support baby. Now, there's lots of research taking place in this arena. The reproductive endocrinologists are the first who really made these observations within their fertility clinics. And there's a lot of science starting to go down on how can we help women rebuild this. This is something that I teach within my birth control hormone reset program. We go through specific nutrients, how to love up your uterine lining, and how to start getting your hormones back on track and supporting overall health. In theory, if we can get your overall health really dialed in, we can upregulate the receptor expression within the uterine lining. You see, epigenetics, that is what your environment does with your genes, plays a huge role in our fertility and our, really, women's health overall. So taking a comprehensive approach and not just looking at, okay, we need more hormones, that's not the answer here. We need to actually rehabilitate the hormonal system if you've been on these contraceptives, and at the same time, we need to undo the damage that they've done. So I hope
Okay, so what this doctor was talking about, prolonged use of contraceptive pills. I have another video from another doctor to educate you some more on the effects of using emergency contraceptive pills. So just watch this one too.
Hello, I'm Dr. Nupur Sood. I'm an obstetrician, gynecologist and a gynec laparoscopic surgeon. I have been practicing for the last 12 years and at present I am heading the Department of Gynecology at Narayana Hospital, HSR. So as the term emergency contraceptive itself means, it should be used only in case of an emergency. It should not be used as a regular contraceptive, first importantly. Second, that it, as understood, it is a hormonal pill. So all hormonal pills do have certain types of side effects. So one should restrict using them as far as possible and use them only in emergency conditions. There are problems such as delayed periods, irregular bleeding, and weight gain which can happen on a long-term basis by taking overconsumption of emergency contraceptive pills.
Okay, so that is it for you. You have seen the effects of using the oral contraceptive pills, but let me just list them one after the other, just as the doctors said it. The first thing is it will cause nausea and vomiting. It will cause dizziness and headaches. It will cause tiredness and fatigue. It will cause tenderness of the breast. It will bring allergies and rashes. It will cause lower abdominal pain and cramps and diarrhea. It will cause or give you vaginal discharges. It will change your eyes. You will bleed in between periods and have very heavy menstruations. And then also, it has a potential impact on the length of your menstrual cycle. That means instead of having a 5-day or 7-day menstrual cycle, you can have a 2 days, or you can have a 12-day or a 10-day menstrual cycle, just because you're using contraceptive pills. And then you can have ectopic pregnancies, and then women can also experience unexpected bleeding after they keep using the emergency contraceptive pills. And then emergency contraceptive pills should not be taken during, or should be taken during, it should be taken when it is an emergency. It shouldn't be taken just like that. It shouldn't be taken like people take paracetamols. And then also, you should look at this too. If you had unprotected sex in a day, in a week, after taking emergency contraceptive pills, you are at risk of becoming pregnant. So if you don't take the pills immediately, but you take it after a week, you still get pregnant, especially if you didn't ovulate when you took the contraceptive pills. And I'm saying that they would delay your periods for a week, and then they would throw your menstrual cycle or your menstrual cycle out of gear. And then also, if your menses is not coming after you took the emergency contraceptive pills, it's important that you do a test. Now watch this last video.
Birth control pills. Birth control pills work by preventing ovulation. No egg is made, therefore there's nothing for the gamete to fertilize. Pregnancy cannot occur. The pill is employed by nearly 16% of girls aged 15 to 44 years within us, and it's each blessing and drawbacks. People with totally different risk factors is also suggested to use a specific reasonably pill. There are different types of contraceptive pills. They all contain artificial types of the hormones estrogen, progesterone, or both. Synthetic progesterone is called progestin. Combination pills contain progestin and estrogen. The mini pill contains only progestin. Here are 10 side effects of birth control pills. 1. Intermenstrual spotting. Breakthrough vaginal bleeding is common between expected periods. This typically resolves among 3 months of getting down to take the pill. During recognizing, the pill is still effective as long as it has been taken correctly and no doses are missed. Any one UN agency experiences 5 or a lot of days of hemorrhage, whereas on active pills or heavy bleeding for 3 or more days should contact a healthcare professional for advice. This hemorrhage might happen as a result of the womb as adjusting to having an agent mucous membrane lining, or as a result of the body as adjusting to having totally different levels of hormones. 2. Nausea. Some people experience mild nausea when first taking the pill, but symptoms usually subside after a while. Taking the pill with food or at hour might facilitate. If nausea is severe or persists for extended than 3 months, you should seek medical guidance. 3. Breast tenderness. Birth control pills might cause breast enlargement or tenderness. This unremarkably resolves a couple of weeks when beginning the pill. Any one UN agency finds a lump within the breast or UN agency has persistent pain or tenderness or severe breast pain ought to obtain medical facilitate. Tips for relieving breast tenderness: embrace reducing caffeine and salt intake and sporting an ancillary undergarment. 4. Headaches and migraine. The hormones in contraception pills will increase the possibility of headaches and sick headache. Pills with differing types and doses of internal secretion might trigger totally different symptoms. Using a low-dose pill might cut back the incidence of headaches. Symptoms unremarkably improve over time, but if severe headaches start when you begin taking the pill, you should seek medical advice. 5. Weight gain. Clinical studies haven't found the same link between the utilization of contraception pills and weight fluctuations. However, fluid retention might occur, particularly around the breasts and hips. According to one review, most studies have found an average weight gain of under 4.4 pounds, 2 kilograms, at 6 or 12 months with progestin-only birth control. Studies of other birth control methods showed the same gain. Some varieties of secretion contraceptive are joined to a decrease in lean body mass. 6. Mood changes. Studies counsel that oral contraceptives might have an effect on the user's mood and increase the chance of depression or different emotional changes. Anyone experiencing mood changes throughout pill use ought to contact their medical supplier. 7. Missed periods. Even with correct pill use, an amount might typically be lost. Factors that may influence this embrace stress, illness, travel, and hormonal or thyroid abnormalities. If the amount is lost or is incredibly lightweight, whereas mistreatment the pill, a pregnancy test is recommended before starting the next pack. It is common for a flow to be a flare or lost altogether now and again. If concerned, seek medical advice. 8. Decreased libido. The internal secretion or hormones within the preventative will have an effect on drive or concupiscence in some individuals. If weakened concupiscence persists and is pestiferous, this should be discussed with a medical provider. In some cases, the birth control pill can increase libido, for example, by removing concerns about pregnancy and reducing the painful symptoms of menstrual cramping, premenstrual syndrome, endometriosis, and uterine fibroids. 9. Vaginal discharge. Changes in emission might occur once taking the pill. This may be a rise or a decrease in epithelial duct lubrication or modification within the nature of the discharge. If epithelial duct condition results, added lubrication can help make sex more comfortable. These changes aren't typically harmful, but alternations in color or odor could indicate an infection. Any UN agency regarding worries is bothered about such changes ought to speak with their medical supplier. 10. Eye changes. Hormonal changes caused by the contraception pill are joined to a thickening of the tissue layer within the eyes. Oral contraceptive use has not been related to a better risk of disease, but it may mean that contact lenses no longer fit comfortably. Contact lens wearers ought to consult their eye doctor if they expertise any changes in vision or lens tolerance throughout pill use.
I am just doing the education, and all that I said, I just wanted confirmation from people who are certified, doctors, and people who have done the research and done the work in this area. So when you hear from them too, you get to believe that what I'm saying is not just coming from Mr. Smooth, but what I'm saying is a fact. So if you're a lady and you're watching, this is specifically tailored to you if you have decided to use emergency contraceptive pills or even be on contraceptive pills. It is your decision, actually. You have seen the benefits, just preventing you from getting unwanted pregnancies, and you have seen the numerous side effects. You've heard it from doctors who are in the field talking about these things. My time is up, but I'll just play a short video from a pharmacist so that you also see that it is not just the doctors who are talking about these products, but a pharmacist also is speaking against using some of these products.
The issue with the post-nuptial is that it's meant to be used at least 2 to 3 times in a month. But in some cases, people use it 4, 5, 6, 7, and there's going to be a side effect.
Hello guys, it's Stephanie, the health teacher here again on the Health Lounge with Stephanie, and today we'll be talking about something very, very important, which is a question I've gotten 1,000,001 times from a lot of ladies concerning the use of the post-nuptial, otherwise known as the morning after pill. Are there any side effects? Wait and let's find out. Today in this episode, pharmacist Nuruddin Oketade answers the question on a lot of our minds. To get more interesting and informative health content here on this channel, do not forget to click the subscribe button and the notification bell as well, so you'll be the first to know the next time a video drops.
licensed pharmacist with Maitama District Hospital and Tonia Pharmacy in Maitama. Birth control pills, they are pills that contain hormones usually produced by the body, but in this case we are using them to prevent conception or pregnancy, and they are combined. That's the one that has the progesterone and the estrogen, while some that have just the progesterone. Okay, the Postinor 2, that's levonorgestrel, that's the generic, is a progesterone analog. It works in the same way as progesterone, preventing conception by either thickening the wall of the cervix or preventing the sperm and the ovum from merging. The issue with the Postinor 2 is that it's meant to be used at least 2 to 3 times in a month, but in some cases people use it 4, 5, 6, 7, and there's going to be a side effect. From some studies, when you are taking it, you are like replacing the one that is already in the body and suppressing the one already there, so it's going to cause hormone imbalance. That's the major one. When it's being overused, then this major side effects that usually come, which are breakthrough bleeding, nausea, vomiting. It could also cause gaining of weight in some. It has been found to cause gain of weight. Those are the major side effects, especially the breakthrough bleeding, which is due to the suppression of the endogenous hormones in the body.
Okay, so you have heard it, you have seen it. You've heard it from doctors, you have heard it from Mr. Smooth, you have heard it from a pharmacist. So if you are a lady and you are thinking of using Postinor 2 or using any emergency contraceptive pills, that is it. This video will be on my YouTube channel tomorrow morning, so Papa Kwamna, Mr. Smooth, subscribe so that you'll be the first to watch if you want to repeat. Yes, this one is also live on GNTV's Ghana network. It will be on Facebook as well, but if you want to get just a segment of the program, just get to my YouTube channel, Papa Kwamna, Mr. Smooth. I'll put this video there tomorrow in the morning. Great. So I'm ending the class for today. I'm sure you have learned something amazing today. I am touched. Normally when it gets to doing shows like that for women, I become a little touched, I am touched. I'm just trying to save some of our young girls, help them not get into some mistakes that some elderly people have done or committed and then regret eventually. There's a lot of life ahead of you if you're a young person, you have not started these things. Protect yourself. Save yourself. Don't get into some of these things because eventually it's not going to hurt you, but it's not going to harm you, but hurt you. So here,